Once you get your medicines, they'll arrive. You'll have insulin syringes and your vial of medicine. The vial may look a little different, but the process of giving yourself an injection is extremely simple and very routine. First, you'll take the protective covering off the top of your vial, and once you peel that off, there will be a rubber stopper that you'll see. You open your insulin syringes, and your insulin syringes typically look like this. On one side, there are numbers in increments of 10, from 10 to 100. Your instructions to give your first dose of medicine are going to be on the bag that the vial comes in. So your dose may be 10 units, it may be 15 units. Everyone is different. Take the top off of the insulin syringe. Then you will pull your syringe down to your initial dose. Here you'll see the dose is 10 units. You take the top off and you can see the needle is extremely small. So in the center of the rubber stopper, there's a circle. You want to inject the needle in the center of the circle and turn the vial upside down. You're going to pull back until there's liquid. It's clear in this case. At the number that your dose is listed. And you can see this is to 10 units. There may be a little air in your syringe, and you can always push up and pull it right back out to get the air out. If you don't get all the air out, it's not that big of a deal. If it's a really small bubble, you're not going to hurt yourself. That's all you have to do with your syringe or your vial. Now you're ready to give your injection. So, where do you give your injection? You can give your injection in your abdomen. That's the most common place to give your injection. You can give it in your thigh. You can give it in the back of your arms. It's the easiest to give it in your abdomen. The one thing that we tell everyone, if you give your injection in your abdomen, you want to make sure you give it more than an inch away from your belly button. Don't give it too close to your belly button because it can affect the absorption of the medicine. When you're giving yourself your injection, there's no need to rotate injection sites because this is given once a week. You can give it in the same place every week. You can rotate injection sites if you want to from one quadrant to the other. So when you're giving your injection, get to the spot that you want to give in your abdomen. Typically, you're going to pinch a little bit of skin to make sure that you have plenty of fat for the medicine to absorb in. If it's your first time giving yourself an injection, you're probably going to be playing a little mind game with yourself, but I promise you this needle is very small and it doesn't hurt. Rubber band popping feels more painful than this injection. Put your needle at 90 degrees to your skin, and it's best to do it if you're just act like you're throwing a dart. Just pop it in really fast. Don't go slow. If you go slow, it hurts more. So you push it in straight into your skin. You stabilize the top of the needle, and then typically you can use one of your other fingers to push the plunger down to administer all the medicine. After the medicine is all administered, you just take the needle out pretty quickly, just with the same motion, dart-like motion that you put the needle in. And then you can recap the needle and dispose of it appropriately. You may have alcohol wipes. You can disinfect the area that you're administering the injection with the alcohol wipes. However, because this is a sub-Q injection, it's not required to do that, but you can do it. Remember, this vial is your supply of medicine, and follow your individualized dosing instructions that are on the package that the medicine comes in. If you do have any questions, please don't hesitate to reach out to one of our team members through email, phone calls, or our virtual messaging system. We're excited to be a part of your health journey and see you achieve your goals.